Hello, David Sweeney here, chiropractor from Dublin to Chiropractic. In this video I want to talk to you about migraine headaches, what they're all about, and if you are a sufferer. I've basically looked at the Migraine Research Foundation and tried to summarize everything in there and break it down into a short video that's easy to understand. This is a subject that I'm really passionate about because I've suffered from migraine headache since I was a teenager, early adolescent basically. So here's some facts for you right away. Migraine headache is actually the sixth most disabling condition in the world. It amazingly affects 12% of the population, and women unfortunately are disproportionately affected over men. So the migraine tends to run in families, okay, and most people get one or two attacks per month. And it's not just a headache, okay, because 90% of people with the migraine are completely disabled, so they can't go about their normal activities, they can't go to work. The pain is typically severe and throbbing. It usually affects one side of the head. That's certainly true for me, so mine's is always up in here. Often it feels like it's right there. In 1/3 of the cases, it's both sides of the head. The symptom of migraine is often accompanied by other disabilities such as extreme sensitivity to light and sound, touch and smell. Also, someone can experience tingling or numbness in their face or into the extremities, so that's arms or legs. Also, nausea, vomiting, and dizziness can occur alongside it. 25% of migraine sufferers get an aura, which is a visual disturbance, and that will last for about 1 hour or so. Usually less than 1 hour, and it precedes the headache. So what does that mean? I get the aura style headache, so I'll get like a big blind spot up in here, as if there's like a big white blob in my vision, and I can't see very well. So when I get the aura, obviously I can't drive anywhere. If I'm driving the car, I have to pull over until that passes. And then the migraine attacks with a vengeance. And for most people, it will last about 4 to 72 hours with the migraine. Okay, so let's talk now about the chronic migraine sufferers. And this is someone that's experiencing a mixture of severe tension headaches and migraines more than 15 times per month. And what they've discovered is they think it's because of medication overuse for migraine. And they call this medication overuse headache or a rebound headache. And it's categorized as chronic migraine. And unfortunately for these folks, they are really debilitated by this problem, and it looks like it's because they're using painkillers during the migraine attack, and it's almost prolonging it or bringing it back. I think that's why they've named it the rebound headache, because it keeps reoccurring, because this neurological event or this neurological condition that happens, that's triggered, I think it probably needs to run its course, and that's the attitude I've taken with my migraine headaches now. Now, luckily, my migraine headaches have actually changed a lot since my teenage years, and I'll talk a little bit more about that as we go through this. Okay, so look, I'll put the link to the Migraine Research Foundation in the description, so you can kind of check that out and read through everything you want there. So let me talk to you a little bit about my migraine history. So it started in my adolescent years, and it got to the point where it was just every month. So a kind of standard classic migraine, aura, severe headache, debilitating headache with nausea, vomiting, occasional dizziness maybe, photophobia, all of that stuff. And that went on for many years. Tried medications and different preventative medications and things of that nature. It never really worked for me. And when I turned 19, I started to get chiropractic treatment. I went to the Welsh Institute of Chiropractic to train at the tender age of 19, and I started getting adjusted. So what's interesting is when you enroll in the college, you become a a patient for one of the senior students, so they assess your spine and begin treating. And what was super interesting about that is, as the months went by and I started getting some treatment, things were just getting a little bit easier. I found that the headaches weren't as maybe frequent, and that was a bonus. But fast forward then a few more years, where I was getting the neck really adjusted, and I started practice in 2010. I was getting adjusted really regular by, I would have to say, better chiropractors, right? Not students, better chiropractors. And I always found this upper neck was extremely tense, and that was creating a lot of alleviation for neck pain I was getting, and suddenly the headaches were non-existent anymore, which was fantastic. Now, obviously, if I drank too much, that could trigger it. And generally, food doesn't create any triggers for me. So sometimes if I drank too much, that could trigger. But on the whole, I wasn't getting this monthly migraine. It wasn't really affecting my life anymore, which was fantastic. So it's something I see regularly with my own patients when I'm adjusting their neck. They often report that their migraine is reducing in intensity. For the most part, I wouldn't say that it completely clears up migraine sufferers condition, but it seems to have a nice effect on the condition itself. So if I were you and I was suffering from migraine right now, I'd definitely be having my neck checked by a chiropractor. That'd be a great strategy. Get that neck adjusted and resolved, and talk to the GP. Think about different medications, preventative medications as well you might trial, but bear in mind as well the medication overuse headache that can create a chronic type migraine sufferer. So bear that in mind. Make sure you read through the foundation's research there as well. Super interesting, super helpful. The other thing is diet. I remember treating a lady, I was getting nowhere, adjusting her neck fairly regularly, a couple of times per week. She wasn't responding, and so we sent her for some food testing, and I'll pop a link if you're in Dublin, Ireland. Check these guys out. It's the Fitzwilliam Food Testing Clinic. She went there, she got food tested. Turns out she had some intolerances. She removed the intolerances, and hey presto, things got better for migraine, which was amazing for her. I've had experiences where I've been treating a particular patient. He jumped into my mind now. No success at all with the headache, none, and he had to be medicated. So in terms of chiropractic, it has its day, definitely. It seriously can impact the headache. It worked for me. I mean, I just am such a big advocate for chiropractic and helping migraine now, because I've experienced that personally, and it's really been transformational for my own quality of life. And if you're a migraine sufferer, you'll know that as well, how annoying and debilitating they can be. And the other final thing I want to talk about here is obviously hydration. So lots of water all the time. I know for a fact that when I'm dehydrated, such as maybe you might have had a few drinks, you might be hungover and dehydrated the next day, that is going to trigger a headache, definitely. So you don't want to be in that category. You want to be drinking lots of water. Here's the other thing, right? Stress is a major health risk for all systems of the body, whether it's your heart, your immunity, your digestive function. If you're a headache sufferer, global arterial sclerosis, so that's heart disease. And the reason why that's true is because our body needs to be in a state of rest and digest. The technical term for that is the parasympathetic nervous system. Stress induces the sympathetic function of our nervous system, and this is a really primitive reflex, or a primitive nervous system that becomes activated, and it's the fight or flight. We've all heard that term before. So the fight or flight state is not where we want to be ever with our body. Now, it's okay to be in that state for maybe 20 minutes. So imagine a bear or a mountain lion suddenly appears on the path. Boom, our physiology changes. We get into sympathetic function, which is fight or flight, and the whole body changes gear, and our heart rate goes through the roof. Our lungs can take more oxygen in, so they begin to expand. Our muscles receive something like 200% more blood to the skeletal muscles. The organs in the abdominal section get drained of blood, and that's because this function isn't going to help you right in this moment. Think about if you've ever watched Saving Private Ryan. Do you remember the Omaha beach scene when they're about to land? It's a horrific scene. I've never seen it. That movie scarred me for life, and I never want to go to war or anything like that. It was horrendous. But basically what happened was, you see these guys throwing up, and the reason why that happens in war is because the person's so unbelievably stressed that the body gets rid of all of the stomach, right? All the contents of the stomach, because all the blood pulls away from it. Now, the really annoying thing about your brain, our human brain, is that it cannot tell the difference between a real physical threat and an emotional stressor. They actually activate the same primitive reflex, which is the sympathetic nervous system. And that is really destructive. And I can tell you that when I've been in that state, and luckily now I'm a little bit older and I'm a bit more experienced, so I can readily catch myself in this state, and I know how to stop being in that fight or flight mode. So the important thing here is to identify when you are stressed. And for me, it was a huge trigger, and it still can be a big trigger for my migraine. So when you practice meditation, this can pull you out of the sympathetic state and back into parasympathetic function, which is where exactly you need to be. So how does it work? Well, meditation, when you listen to someone like Eckhart Tolle, he explains it as mind emptiness. Now, you hear a lot of people talk about mindfulness, but it's actually should be called mind emptiness, because that's the essence of meditation. That's very simple. You're just stopping negative thoughts or circular thinking, and you're just trying to be present. And a very simple way to do that is focus on your breathing. So that's all I do. I maybe lie in bed and close my eyes and focus on breathing in and breathing out. I can slow it down if I want. I can do 4 seconds breathing in, 4 seconds breathing out, 7 seconds breathing in, 9 seconds out. Doesn't matter, whatever you want. But the practice here is to shut out all thought process, and that is extremely difficult. And it may take you a couple of sessions to try to get into the feeling of it. But when you hit that present time consciousness, you can really appreciate how different your body feels afterwards. Now, I just set an alarm for about 20 minutes because I want the session to end, but I want to make it good, make a nice effort at it as well. So that's why I set a timer. You don't have to, but it's a great method. So if you're really struggling with migraine headaches or tension headaches or neck pain or a whole host of health issues, and you're trying to turn your health around, this is a nice starting point. This is one area that you want to address, along with some others. So if you are suffering from those headaches, give it a go. See what the meditation does for you, and let me know if you've tried chiropractic as well. I would love to know your story about your chiropractic experience with your neck being adjusted and how that influenced your migraine headache. And please subscribe as well. It really helps me out, and I've just started the channel, and hopefully I can keep creating some content. Hopefully it's valuable for you as well. So please like, subscribe, and I'll see you on the next video. Cheers.